Hello, everybody. My name is Matthias. This is my patient today, Kyle. Kyle, how's it going?
Hi.
All right, we're going to do the GI, musculoskeletal, and neuro assessment. All right, so first off, I'm looking at the appearance of my patient. Looks to be in a good mood. I don't see any abnormalities noted right now, any lesions just by looking at him. Seems to be in a good mood. Kyle, you're in a good mood today? All right. All right, so Kyle, you told me your name. Do you know where you are right now?
Yep.
Where are you?
My house.
Okay, do you know the month and the year?
June 2024.
Very good. So Kyle is alert oriented to place, time, and person. So alert oriented times 3. He's in a good mood. I notice his skin color is appropriate for his ethnicity and his race. I do notice a little cut right here, but you did have a moving, you were moving today, so I'm assuming that's from that. Okay, we're gonna go on to his abdomen. So Kyle, if you could just lay back on your back, we're gonna start inspecting your abdomen. Okay, so I'm just gonna lift the shirt up here. I have his abdomen exposed. Okay, I'm inspecting his abdomen. I don't see any abnormalities, no distension right now. Just by looking at it, I don't see any peristaltic waves. Peristalsis should not be observable. Could indicate some obstruction, but I don't see any peristalsis. I don't notice any jaundice right now. So inspection of the abdomen is good. Now I'm going to auscultate the bowel sounds in each quadrant. Now normally bowel sound auscultation should take between 2 to 5 minutes, but we're going to go a little shorter for lack of time. So I'm going to start with the right lower quadrant, listening for bowel sounds. Okay, okay, right upper quadrant, left upper quadrant, and left lower quadrant. I hear normal active bowel sounds, which is a normal finding. No hyperactive, no hypoactive, all normal active bowel sounds. That's a normal finding. We're going to continue with auscultating the vascular sounds of the aorta, bilateral renal and iliac arteries. So I'm going to auscultate the aorta. I'm looking for bruits, venous hums. So aorta is midline above the umbilicus. Okay, no bruits, no venous hums there. Okay. Okay, so the bilateral renal and the bilateral iliac and the aorta, I don't hear any bruits, no venous hums. That's a normal finding. I'm going to go ahead to percussion. I'm going to percuss each quadrant. There should be tympani noted throughout. There shouldn't be any dullness, so I'm going to go ahead and percuss. Tympani, 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 tympani. Sounds like a little drum sound, so I noted tympani in all 4 quadrants. We're going to move on to percussing the liver. The liver, we're going to go to the left, to the right of the umbilicus, mid-clavicular line. So in order to percuss the liver, we're going to hear dullness. That is a normal finding. So I'm going to start from below the umbilicus to the right mid-clavicular line, going down to up until I hear dullness. And there's dullness right there. Right under the costovertebral angle on the right side. Now I'm going to go from the chest and I'm going to come down mid-clavicular line to measure the liver. So I'm going to check for dullness. Okay, and I do hear dullness right there. And normal liver size should be between 5 to 12 centimeters mid-clavicular. Okay, so we're going to go ahead and percuss the spleen next. That's located on the left upper quadrant. There should be tympani heard as well. So I'm going to go to the left upper quadrant right here. And I do hear tympani. If I did hear dullness, that could indicate enlargement of the spleen or splenomegaly. No dullness heard. So that is a normal finding to hear tympani in the area of the spleen. Now, next up, I'm going to do light palpation. So I'm going to tell my patient, Kyle, I'm going to do some light palpation. That's with one finger, just lightly, about 1 to 2 centimeters in, just percussing for any masses and noting any tenderness, any guarding, any pain, Kyle?
No.
Very good. So upon light palpation, normal findings. I know it's a little ticklish, and it's normal for the patient to feel a little ticklish when you're palpating their stomach. Next up, so that was with one hand. I'm sorry, I said one finger. That's one hand. Next, I'm going to do two hands for deep palpation as well. I'm going to, you're really feeling in. I'm sorry, Kyle, if this hurts. It shouldn't hurt, but you let me know if it hurts. I know it might feel a little ticklish. So two hands. Okay, again, feeling for any masses, lesions, noting tenderness, guarding. I don't notice any of that. So that is a normal finding. Okay, we did light and deep palpation. Now I'm going to palpate the abdominal aorta above the umbilicus on the right and left side. I'm palpating the aorta, noting any enlargement of the aorta, which I don't feel any enlargement. Enlargement of the aorta could indicate an abdominal aortic aneurysm, which it doesn't seem like you have one of those, Kyle, so you're good in that department. Okay, next up, I'm going to palpate the liver border. So I'm going to go on the right upper quadrant, right under the costovertebral angle, and I'm going to palpate, and I'm going to ask Kyle to take a deep breath. So I'm going to palpate right in the ribcage, deep breath. There you go. Very good. And when he takes a deep breath, the liver actually is able to push on my hand, and that's how you palpate for the liver border. Next up, I'm going to palpate the kidneys. Now, the kidneys, normally they shouldn't be palpable. Now, in a very thin person, you could palpate the right kidney. Let's see, Kyle, if I can palpate left kidney. I don't feel anything. Right kidney, palpating. I have one hand over the right lower quadrant, one hand behind. I don't palpate anything for the right kidney. That's okay. It's normally not palpated, but very thin people, it could be palpated. Next up, I'm going to palpate the spleen. Just like the liver border palpation technique, I'm going to go in the left upper quadrant, and I'm going to ask you, Kyle, to take a deep breath. Okay, you can exhale. Okay, normally you shouldn't be able to feel the spleen. It's not enlarged, so that means it's not palpable, which is a good thing. If it was enlarged, I would be able to palpate the spleen, but in this case, it's not enlarged, so I don't feel it. Okay, we're going to move on to the upper extremities. Okay, so Kyle, if you could take a seat. You're doing great so far. How are you feeling?
Great.
Very good. All right, so I'm going to go ahead. I'm going to start inspecting from the clavicles, scapula, the shoulders. I'm inspecting the clavicles, inspecting the shoulders. Okay, nice tattoo. Okay, and the scapula, it's noting any abnormalities, any lesions, signs of trauma, masses, which I don't know any of them right now. No distortion noted. Okay, so I'm going to go ahead and palpate the joints. So you have the sternum right here, you have the sternal notch. I'm going to go ahead and palpate along the sternoclavicular junction. Okay, no lesions noted. Here's the AC joint. I'm going to palpate around it. I don't notice any abnormalities. Okay. You have the deltoid here. Deltoid here. Don't feel any tenderness, any firmness, any tenderness, Kyle? Very good. You got the triceps and the biceps. Okay. You got the elbow. I'm palpating around the elbow. Palpating around the elbow. Seems to be okay. Palpating around the wrists. Any tenderness, Kyle?
No.
No lesions, no bumps. Okay. No abnormalities, no signs of trauma. Okay. Looks good. Okay. So next up, I'm gonna test the range of motion and strength of the neck, shoulders, and elbows. So Kyle, let's start off with your neck. Would you be able to look up for me? Very good. Now look down. Very good. Now look right. Now look left. Very good. Can you put your right ear to your right shoulder? Now can you put your left ear to your left shoulder? Very good. Now I'm going to put my hand on your face. Look left for me. Very good. Very strong. Very strong. Okay, now right. Very good. You work on your neck?
No.
All right. All right, so we're going to keep going to assess the shoulders. Now, Kyle, can you put your arms above your head? Very good. Now, can you go down? Very good. Testing flexion and extension. Okay, Kyle, can you bring your arms in front of you and can you crisscross them? Very good. Now, can you, with your right hand, can you reach back to your opposite scapula? Very good. Now, do the same with your left. Very good. Nice and flexible there. No abnormalities noted, no pain, no grimacing. Okay. With the elbows, would you be able to bend your elbows, try to touch your shoulders? Very good. Very good. Now can you put your arms out and just turn up and down? Good. Supination, pronation is intact. Very good. I'm going to test next the reflexes of your biceps, brachioradialis, and the triceps. I'm looking for a reflex. So I'm going to start with your biceps. You feel for the tendon. Tendon right here. Very good. I'm going to test the brachioradialis. Very good. Okay. And the triceps. Okay, sorry. Very good. The opposite, again, feeling for the tendon of the biceps. Very good. And for the tendon of the brachioradialis. Very good. And then again, triceps. Very good. Okay, so your reflexes are intact. Now we're going to palpate the pulses of the radial and the brachial. And for a nice pulse here. Okay, +2. See your arm a bit for me. Okay, +2. Gonna go to the right. Palpate the radial pulse. +2, which is expected. And again, palpating the brachial pulse. +2, which is expected. Very good. We're going to move on to inspection and palpation of the hands. Looking for any nodules, any lesions. Okay, so just by looking at your hands, I don't see any lesions, any noticeable nodules. No ganglion cysts. I'm going to do palpation. Noting any lesions, tenderness. Any tenderness when I'm touching, Kyle?
No.
Very good. Very good. No lesions. Okay. Very good. Everything is as expected so far. Not noticing any abnormalities. Okay, we're gonna move on to range of motion and strength of the hand and wrist. Okay, Kyle, with your hands, can you put your fingers to the ceiling? Very good. Now to the floor. Okay, now can you go up? Supination and down, pronation. Okay, now can you spread your fingers out? And can you put your fingers in? Make a fist for me. Very good, perpendicular to the ground and down. Very good. Okay, so everything, all the movements seem to be smooth, coordinated. I don't notice any abnormalities, any tenderness, Kyle. Very good. Okay, we're gonna keep going. Real quick with your wrist, can you go left and right? Very good. I just want to make sure that's okay. Now we are going to move down to the hips. So Kyle, would you be able to lay flat on your belly for me? Okay, so we're going to do palpation and range of motion of the lower extremities. Okay. So I'm going to lift the shirt up a bit. Shorts up a bit. Okay. So I'm looking for the Okay, just doing some palpation, some inspection. I don't notice any abnormalities, any lesions. Okay, I'm palpating here. You got the iliac crest, going to the anterior superior, anterior superior, anterior superior AS, IS, the spine. Okay, I'm going backwards. You see the bursa, the greater trochanter. Okay, I have the dimples here, which is the PSIS, the posterior superior inferior spine. That's what I was looking for. I'm palpating. And the same for the left side. I have the looking again to the anterior superior inferior spine, going around, going to the left sided PSIS, seeing the bursa, okay, and as well, no abnormalities noted there, okay. The crest is intact, the greater trochanter on the left side is intact as well. Okay, very good. Now, Kyle, would you be able to? When you're, you can remain like that. I'm just gonna test. Would you be able to lift this leg up and push? Very good. Lift and push. Very good. Okay. So, Kyle, if you could sit down for me. Thank you, sir. You're doing a great job. Okay. Would you be able to lift your legs up? Lift your legs. Lift your legs. And now bend them, bend them. That's extension, that's flexion. Very good. And bend them to the couch. Very good, very good. Okay, so extension and flexion is intact. Okay. Now, Kyle, would you be able to stand up for me with your left leg and face that wall for me, please? Can you put your left leg forward and back? Now with your right leg, do the same, forward and back. Now with your left leg, can you go outwards? Okay, now with your right leg, can you go outwards? Very good. And now can you put it in front of the other? So we're testing adduction, abduction. We did extension and flexion, and everything seems to be intact. Okay, Cal, if you could take a seat for me, please. We're gonna go ahead and palpate, inspect and palpate your ankles and feet. Okay, so I'm looking at your feet, your ankles, looking for any abnormalities, any lesions, any cysts. Okay, everything seems to be good. Oh, and I also got to do the knees as well before we get down to that. I missed that. Looking at your knees, looking at your patella, your meniscus, inspecting it, I'm palpating. Okay. Very good. Can you lift this leg up and come back down? Testing the range of motion of the knees. Lift the leg up, come back down. Very good. Okay. Okay. Very good. We're gonna move forward to the ankles and feet. Again, I looked at them already. They seem to be intact. No lesions, no cysts noted. Okay. We're gonna palpate them. Again, looking for any abnormalities, any lesions, any cysts, any tenderness, Kyle?
No.
Okay, very good. Can I look at the bottom of your feet? Very good. This one. Very good. Alrighty. Okay, so that was inspection and palpation. Now we're going to test range of motion and strength. Kyle, would you be able to lift your left foot up for me, please? Okay, point your toes up and point them down. Very good. Can you roll your ankle to the left and to the right? Now do the same with your right foot. Point toes up, point toes down, roll ankle to the left and right. Very good. Range of motion is intact there. I'm going to palpate the pulses now. You can put your left leg on my leg, please, just for the camera to be able to see. Palpating the dorsalis pedis. I have +2 there. I'm palpating I'm feeling for the posterior tibialis, which I have +2 there. And with the right foot, dorsalis pedis, +2, posterior tibial, +2. Very good. Okay. We're gonna assess the patellar reflex. This is the famous patellar reflex test. So I'm gonna hit your patella. Very good. Okay, so patellar reflexes are intact. You had a little jerking motion when I use this guy right here. Okay. Oh, and now we're gonna do the Achilles and the plantar reflex. Okay, Kyle, would you be able to lift this guy up for me? Achilles, right back here. I'm looking for a little jerk, which I got. Same thing here. Very good. Okay, and now we're gonna test the plantar reflex. Kyle, for the camera to see, I'm gonna use this side, and we're looking for curling of the toes, which should be a normal fine. And there we go. Very good. I know it's a little ticklish, Kyle. Very good. Now, if there was fawning or the toes would spread out, that could indicate, that would be normal in babies, but in adults, that could indicate a neurological deficit, which you do not have, Kyle. You exhibited the right reflex. Okay? Now we're gonna continue to the spine. Kyle, if you could stand up for me, face that wall for me, please. I'm inspecting the spine, inspecting the curvature of the spine. Just gonna lift your shirt up. Inspecting the curvature of the spine, looking at the muscles here. Got the latissimus dorsi. Everything seems to be symmetrical and intact. Okay, I'm going to palpate the spinal column. Okay, palpating the muscles. Make sure there's no lesions, no masses. Any tenderness, Kyle?
No.
Very good. Doing a very good job of not laughing at my, I know it could be ticklish. Okay, so palpation was good. Spinal column is midline. Muscles are intact. No lesions, no masses noted. Now I'm going to test the range of motion. Kyle, would you be able to try to touch your toes just straight down? Good. And while he's like that, I'm also assessing curvature of his spine. Very good. Very good. Now, Kyle, can you stand straight up? Very good. Now, that was flexion. Now come back. Extension. Nice. Feels good, doesn't it?
Mm-hmm.
Very good. Flexion, extension of the back. Okay. Any tenderness when you did that, Kyle?
No.
Very good. Now I'm going to ask you to take a seat for me, Kyle. We're going to test the RAM, the rapid alternating movements. Put your hands on your knees, Kyle. I'm going to ask you to go up and down. I'm looking for smoothness, coordination. Now give me fast, fast, fast. There you go. There you go. Very good, very good. So I noticed smoothness, very coordinated. It doesn't have any deficits that I noted. So that was RAM. Now I'm going to ask you, Kyle, if you could, with your right heel, if you can go up and down your left shin. Nice and smooth, nice and coordinated, and vice versa, please. Smooth and coordinated. Very good. I'm going to test the exteroceptive sensation, superficial pain first. Now, Kyle, I have a dull object and a sharp object. I'm going to ask you to close your eyes, have your hands out. You tell me if it's sharp or dull. I'm testing superficial pain here. Okay? Sharp or dull?
Sharp.
Very good. What about now?
Dull.
Very good. What about now?
Sharp. Dull.
Very good. You could open your eyes. So superficial pain is good. Now, Kyle, if you can close your eyes. I have a hot and a cold liquid in these cups. Now, Kyle, I'm going to ask you to put your finger in the cups, and you tell me if it's hot or cold.
Hot.
Very good.
Cold.
Very good. Very good. So temperature, exteroceptive sensation is intact. Now we're going to test proprioception, motion and position. So Kyle, if you can close your eyes, I'm going to take your fingers. I'm going to go up or down, and you let me know if it's going up or down, okay?
Up. Up. Down.
Very good. Okay, now next one I'm going to do is the vibratory. I'm going to use my tuning fork to test vibration. Okay, Kyle, you can put your hands on your knees. I'm going to use the tuning fork to create a vibration. Throw on your finger. You tell me when you feel the vibration and when the vibration stops, okay?
Okay.
Eyes closed. Okay. Tell me when you feel it.
Vibrate.
Good. Now tell me when it stops.
Stop.
Very good. That's a vibratory test, very good to assess for any neuropathy in the patient. Usually start at the lowest point, and you go up, and then you go to the last point where the vibration sensation is intact. Very good for assessing for any neuropathy in diabetic patients. We're going to move on to cortical sensation. I'm going to test for stereognosis first. Sorry, got a little bit of allergies. Sorry about that. We're going to test for stereognosis first. So Kyle, I have 3 objects, a coin, a key, a coin, and a pen. I'm going to ask you to close your eyes. I'm going to test if you know what object is in your hand. So close your eyes for me. What object is in your hand?
Coin.
Very good. Next up, what object is in your hand?
Key.
Very good. Last object is in your hand.
Pen.
Very good. So, this is good. Next up, I'm going to test graphesthesia. I'm going to draw a letter on your hand. You're going to let me know what letter I draw. Close your eyes. Okay, what letter am I drawing?
O.
Very good. What about now?
A.
And what about now?
M.
Very good. That was a tricky one. All right, next up, we're going to do two-point discrimination. Kyle, you can open your eyes. I have 2 points. I'm going to be touching your hand. You let me know when you feel the 2 points and when you only feel 1 point, okay? So this is testing. This is a 2-point discrimination test for cortical sensation. Close your eyes. Let me know when you feel the 2 points.
2.
Okay. Keep going. What do you feel?
2.
Okay.
2.
Okay.
2.
Okay.
1.
Very good. Very good. Okay. Next up, Kyle, I'm going to ask you to stand for me, sir. I'm going to ask you to stand now. I'm observing his standing. Just by looking at his standing, no swaying, any dizziness.
No.
Very good. He's looking good. Okay, Kyle, I'm going to ask if you could walk to that wall and back. Always try to stay in the camera if you can. Looking at his walking. No swaying noted. Very good. Any dizziness?
No.
Very good. Okay. Now, Kyle, can you walk on your heels for me, back and forth? Nice and coordinated. Very good. Little penguin-like. There's nothing wrong with that. Okay. Okay, next up, we're going to do tiptoes. Tiptoes to the wall and back, please. Again, I'm looking for coordination. Very good. And now heel to toe, please. Heel to toe. Very good. Very good. Okay. So again, very coordinated. Looks good. I didn't see any swaying, and I didn't notice any gait instability. So this is a normal finding. Next up, I'm going to test Romberg sign. Kyle, I'm going to ask you to stand with your feet close together. Just look straight ahead. Okay, again, I'm looking for any swaying, any dizziness. Any dizziness, Kyle?
No.
Okay, I'm going to ask you to close your eyes. Again, no swaying noted. That's a normal finding. And lastly, I'm going to test pronator drift. Kyle, if you could extend your arms in front of you, eyes open. Very good. I'm looking for any drift. Now, Kyle, close your eyes. Very good. No drift noted. You can open your eyes. If there was a drift, that could be a red flag for a possible stroke. You'd want to have that looked at, or call 911 if you do suspect a stroke, if there was any drift going on. But Kyle, thank you so much, sir. That concludes our GI musculoskeletal neuro assessment. Thank you so much, guys.